Hello guys. So now we shall be discussing regarding the sympathetic innervation to the head and neck. Okay. So topic of discussion would be sympathetic innervation to head and neck. So the sympathetic innervation to the head and neck, right? So this sympathetic innervation, this originates all the way from T1 to T6 spinal segments. Okay. So all the way they originate from T1 to T6. Okay. Now here there are three sympathetic ganglia. How many sympathetic ganglia we have got? We have got three sympathetic ganglia. So what are these three sympathetic ganglia? One ganglia you call it as all these sympathetic ganglia are present in the cervical region mostly. So one sympathetic ganglia you call it as superior cervical ganglia. Next you have got is the middle cervical ganglia, and third one you got is the inferior cervical ganglia. So here we have got three important cervical ganglia. One is called as the superior cervical ganglia. Second one is called as the middle cervical ganglia, and the third one is called as the inferior cervical ganglia. Inferior cervical ganglia, right? So from these ganglia the postganglionic fibers will arise and then they supply. For example, let us take, this is your spinal cord. Okay, this is your spinal cord. Let us say that here there are nerve fibers. Let us say this is your ganglia. Okay, so if this is, okay, let me draw in another way. Let us say that this is a neuron like this. Okay, so this is a neuron, right? Now this neuron is in continuous with another neuron like this. Now what is a ganglion over here? See, this particular thing is called as a ganglion. So like this, how many ganglia we have got? We have got three: superior cervical, middle cervical and inferior cervical. Let us say this is superior cervical ganglia. Now before the ganglia, this pink color neuron what you see here is called as a preganglionic neuron. After the ganglia, this blue color neuron which you can see here is called as a postganglionic neuron. So this postganglionic neuron is the one which supplies your eye, right, which supplies your ear, which supplies your nose, for example, right? So these are the postganglionic neurons which are supplying to your different organs, right? So that's what I'm telling you, that from these ganglia the postganglionic fibers they continue and they innervate different organs of head and neck. Okay, so from here the postganglionic fibers continue into head and neck. Okay, now let us see what are these ganglia and where are they present. Okay, so first important thing you need to know about this ganglia is, that first of all let me draw the spinal segments over here. Let us say these are the spinal cord segments. This is your spinal cord, let us say. Okay, now in this spinal cord I am going to draw only few. For example, let us say this is C1, this is C2, this is C3 and this is C4. Okay, the second important one, this is C5 and next we have got C6. Okay, and down to C6 we have got C7. Okay, now if you look at these ganglia, the cervical ganglia from where they are arising, all of you just look at these ganglia. From the C1 you see the nerve fibers are coming out like this. From C2 also they come out, from C3 also they come out, from C4 also they come out. Now all of these nerve fibers are relying on another group. So let me shade this part. So all these nerve fibers are relying on another group. So first of all, what is this? All these things over here are called as ganglion. from here the next group of neurons, right, let us say these green color neurons are coming out. Okay. Now this particular ganglion which I have drawn right now here, you see this particular ganglion which I have drawn right now over here, this particular ganglion is called as superior cervical ganglion. So if I ask superior cervical ganglion originates from which spinal segments, what will you tell? It originates from all the way C1 to C4. Okay, from C1 to C4. Okay. Next, after that, if you look at C5 and C6, okay, so from C5 we don't have any kind of the neurons that are coming out, but from C6 we got neurons that are coming out, and from here you got another neuron that is going out. So what is this particular ganglion? This particular ganglion is called as a middle cervical ganglion. So we so far discussed about superior cervical, middle cervical. And next from C7, you have got another neuron that is coming out again, that goes alone here, right. So this particular ganglion over here is called as the inferior cervical ganglion. So how many cervical ganglions we have got? We have got 3 cervical ganglions. So C1 to C4 is your superior cervical ganglion. Next C6 we have got the middle cervical ganglion, and next we have at the C7 we have got the inferior cervical ganglion, okay. So C1 to C4 that is superior, C6 is middle and C7 is inferior. Now if I ask you where is exactly the superior cervical ganglion, so how you have to answer this is that, for example, let me rub away these things. So all of you know that here you have got an artery. This artery which I am drawing right now is called as your internal carotid artery. So this particular artery is your internal carotid artery. Okay, so this particular artery is your internal carotid artery. So if I ask you where is this superior cervical ganglion that is present, you have to tell superior cervical ganglion is lying in between posterior to internal carotid artery and anterior to spinal segment C1 to C4. So if I ask you where is this particular one, what will you tell? It is located behind the internal carotid artery, right, and in front of the spinal segment C1 to C4. So superior cervical ganglion is located posterior to, the internal carotid artery and anterior to C1 to C4 spinal segments, right. Now what we will do is that we will discuss about each and every ganglion and see which ganglion is supplying to which organs, right. So that is very, very important. For example, if we will discuss about superior cervical ganglion, so superior cervical ganglion is supplying to which organs? Middle and inferior are supplying to which organs? Now by looking at this, which ganglion is the largest ganglion over here? Superior. So it must supply many other organs in comparison with the middle as well as the inferior, right. So first of all, let us write down this, and this is a little bit a memory part which you have to revise it all the time. So let us first discuss about the superior cervical ganglion. Superior cervical ganglion. Now superior cervical ganglion arises from all the way C1 to C4. Second important thing, superior cervical ganglion is related with which artery? We already discussed, it is internal carotid artery, right. Actually to tell, if you look at an artery, right. So let us say this artery over here is called as common carotid artery. This common carotid artery is divided into 2 arteries. So one that is going outside is called as external carotid artery. One that is going up inside is called as an internal carotid artery, right. So this artery over here is called as internal carotid artery, and this artery over here is called as external carotid artery. And what is this artery? This is called as common carotid artery. Actually the internal carotid, external carotid and common carotid, all these 3 are nearer to this superior ganglion. So We shall discuss about each and every cervical ganglia, and we shall see what arteries are in relation with the cervical ganglia and to which organs it is supplying, right. So this is little bit a memory part which I want you to remember it at any cost. So first important thing is the superior cervical ganglia. Superior cervical ganglion. Okay. So superior cervical ganglion, all of you just now knew that it is all the way from C1 to C4, right. So it is all the way from C1 to C4. Next important thing is that what are the arteries that are in relation? I already told you the first artery that is in relation is your common carotid artery. Second artery that is in relation is external carotid artery, and third artery that is in relation is internal carotid artery. Now, what are the organs does it supply? That is the effector organs. Okay. So, what are the effector organs? Where this ganglia, the neurons of this ganglia are also called as a postganglionic neurons. They show the effecton. They are called as effector organs. Okay. So, what are these effector organs over here? The first important effector organ is your eyeball. Okay. The first important one is your eyeball. After the eyeball, the second important thing is your face. Third important thing is the glands that are located around the nose. Nasal glands. Fourth important thing is the pharynx. And fifth important thing is the salivary glands. Along with the salivary glands, you even have got lacrimal glands. Now, when I tell salivary glands, what are the salivary glands? You have got a parotid gland over here. Beneath the mandible, you have got submandibular gland, right? Sublingual gland. So, all these are your salivary glands. When it comes to lacrimal gland, see here exactly at this part you have got a gland. Exactly here, this is called as a lacrimal gland. Okay. So, we have got salivary glands, we have got lacrimal gland. Now, after salivary and lacrimal glands, next we have got is the sweat glands. Next, after the sweat glands, you have got pineal gland. Next, within your eyeball, to dilate your pupil, you have got a muscle called as dilator pupillae. So, dilator pupillae. Next, after that, the next important thing is your heart. And after the heart, the 11th important thing is your carotid body. So, these are all the structures where your superior cervical ganglion is actually innervating. Okay. So, we will just revise that later on. The next important ganglion we will discuss is the middle cervical ganglion. Middle cervical ganglion. So, where is this middle cervical ganglion present? It is present at the level of C6. What is the artery that is in relation with this middle cervical ganglion? That is the inferior thyroid artery. Inferior thyroid artery. So, inferior thyroid artery. Next important thing is that let us see what are the structures that it is innervating. Okay. The first important thing is your larynx. Okay, larynx. Second important thing is your trachea. Third important thing is your pharynx. Fourth important thing is your upper esophagus. Fifth important thing will be your heart. Sixth important thing will be your smooth muscle. So, one of the common thing which you need to know over here is that the common thing is both the heart, right? The hearts are supplied both by your superior cervical ganglion. At the same time, the heart is also supplied or innervated by the middle cervical ganglion. So, superior cervical ganglion and middle cervical ganglion commonly innervates what? Commonly innervates the heart. Next, when it comes to the inferior cervical ganglion, superior, middle as well as inferior cervical ganglion. Inferior cervical ganglion. So inferior cervical ganglion, where obviously it starts at the level of C7. Next, what are the arteries over here? There are two important arteries. One is called as a vertebral artery, another one is called as a subclavian artery. Vertebral artery and subclavian artery. Okay. So, to which organs does it supply? One is the heart and second one is your smooth muscles. Smooth muscles. Okay. So, these are the things. So, let us discuss what are the sympathetic innervation to the head and neck. Okay. Now, when it comes to the sympathetic innervation to the head and the neck, they basically originate from T1 to T6. Next, there are three sympathetic ganglion. One is called as the superior cervical ganglion, middle cervical and inferior cervical ganglion. Now, when it comes to the superior cervical ganglion and all, now when it comes to the superior cervical ganglion is not only related with the internal carotid artery, but it is also related with common carotid as well as the external carotid artery. Next important thing, C6, C1 to C4 is the level of superior cervical ganglion, C6 is the level of middle cervical ganglion, C7 is the level of inferior cervical ganglion. Okay. Next, superior cervical ganglion, where is it present? It is present posterior to your internal carotid artery and anterior to C1, C2, C3 and C4. Okay, anterior to C1, C2, C3 and C4. Let us say superior cervical ganglion is supplying to which effector organs? One is your eyeball, face, nasal glands. Next you have got is a pharynx, salivary glands, lacrimal glands, sweat glands, pineal gland, dilator, pupillae, heart, carotid body. All these are the structures. When it comes to the middle cervical ganglion is the C6 and the artery that is related is the inferior thyroid artery. Right, and what are the structures? That is the larynx, trachea, pharynx, upper esophagus, heart as well as the smooth muscle. Next you have got the inferior cervical ganglion at the level of C7 and the associations are vertebral artery and subclavian artery, and heart and smooth muscles are the effector organs, right? So this is all you need to know regarding the sympathetic innervation to the head and the neck. Thank you so much for watching my video. Goodbye.